I want to thank everybody for coming this morning. We're here today joined by Paloma Hernandez, who's the president and CEO of Urban Health Plan in Plaza del Sol that's going to be opening up soon here in Corona. We're here also joined by Dr. Elizabeth Arias, who's a pediatrician, Dr. Edna Rodriguez, who's another pediatrician, Associate Medical Director Biju Jacob, Daniela Rodriguez, who's a community activist, who's in charge of United Hispanic Women, Julissa Ferreira, Chief of Staff of Councilman Peralta's office. And we're here today to talk about two important issues. First, the new vaccination guidelines for children that are starting school next week. And second, we wanted to also talk about and welcome the new Plaza del Sol Community Clinic slated to open by the end of this year. It's going to help alleviate the growing health issues and concerns that our community face. As you know, school starts next week for over 1.5 million children all over the city. And although parents are gearing up and buying school supplies and buying clothing, and I know in the madness and the hectic schedule that they have, they may forget about the most important part, the most important preparation, and that is ensuring that their children are vaccinated. As a father of two children, one in the public school system, we're here today to remind parents that they need to vaccinate their children before they enter school. Not only to remind them, but also inform them and be aware that there's new vaccination guidelines by the New York State Department of Health. Nowadays, vaccinations can be the difference between acquiring certain types of diseases or not. Some of these include diphtheria, tetanus, chickenpox, and measles. Some can even lead to death. This year, parents and caregivers need to be aware that vaccinations for tetanus, diphtheria, and pertussis is required for all students entering the 6th or 7th grade if they're at least 11 years of age. In addition, the chickenpox vaccine is required for all children from pre-kindergarten to the 9th grade. Failure to get vaccinated may exclude children from daycare centers and pre-kindergarten grades 1 through 12. So it's very important to make sure that parents this year, you ensure that you get these shots for your kids. I'm very concerned that diseases like this can lead to death in our children, as was observed in the U.S. epidemic that occurred back between 1989 and 1991, where over 55,000 measles cases were reported and 123 deaths occurred simply because of a lack of vaccine shots. Let me also add that not only are vaccinations important for children, but also for adults. In the U.S., 99% of deaths that could have been prevented by vaccination shots now occur in adults and seniors, and very often occur in foreign-born immigrants, the uninsured, and in areas of lower incomes, like we have right here in Western Queens, in Corona, Jackson Heights, Elmhurst, and East Elmhurst. My assembly district is the United Nations of all assembly districts, and I'm proud to represent it because people from all over the world come here to want to make this place their home. But if you look around, there's close to 60% of the people that live here are foreign-born. They're foreign-born immigrants. The average household income is $38,000 a year. But did you know that in Western Queens, over 1/3 of the adults do not have a primary health care provider? The highest rates outside of the 154 New York City neighborhoods. As you know, this community is an immigrant community, but did you know that over 42% of the foreign-born immigrants are uninsured? This is unacceptable, and that's why we've been leading a campaign with other elected officials, including Councilman Peralta, to make sure that we get affordable health care plans in this area and people get registered to get affordable health plans. It's also a community where 6 times the number of deaths from HIV occur, over 3 times the death of diabetes, 3 times the number of deaths due to high blood pressure, and almost 4 times the death by liver disease. All of this is a recipe for disaster if there is not an affordable place to go. That's why in this area there's a few places that you can go. You can go to Elmhurst Hospital, which is a public hospital. You can go to the city clinic, which is on Junction Boulevard. But there's nothing, absolutely nothing in this neck of the woods, in this area. Now we're going to have Plaza del Sol. Now we're going to have Plaza del Sol, which is a subsidiary of the Urban Health Plan Center. And we're going to have Plaza del Sol shine its rays on our community. And we want to welcome them here today. This is a center that has been known to provide affordable, reliable, and it's award-winning coverage, healthcare coverage in the Bronx. And now they've crossed over the river to come over to Queens in Corona to help our constituents. Both I and Councilman Montrat allocated $500,000 and $250,000 respectively towards the opening of this center. It's going to be a center that's 12,500 square feet of primary and special care. It's going to be open 7 days a week. It has a capacity of 28,000 visits a year and comes complete with 16 examination rooms staffed by 17 health professionals. It will provide services from internal medicine to gynecology, and next year, for all those parents that are watching, next year you can come and you can vaccinate your children right here at this center. And the most important part is that it's going to be affordable, that it's going to be a place where the people in the community can come to and they can bring their children. And I tell Paloma, the CEO of Plaza del Sol, is that within the next 6 months, she's going to be bombarded and she's going to be flooded with individuals that are going to want to use this center. And she's being conservative about the amount of people that she's going to see, but through the word of mouth, I'm pretty sure that she's going to call me, she's going to call Councilman Montrat's office, and she's going to say, we need more space, because that's the necessity in this area. Now, we want to make sure that with all the gas prices that are skyrocketing, all the prices that are going up, electric bills are shocking us, food prices are spiraling out of control, train fares are increasing, the basic necessities are almost out of reach of all New Yorkers. It's comforting to know that we have a place, that we will have a place like Plaza del Sol, because we need to know that New Yorkers can use a place like this. Foreign-born immigrants can use a place like this. The uninsured can use a place like this, whether it's because of lack of information, lack of the English language, or simply because they fall into a lower income bracket. Urban Health Plan, Plaza del Sol is going to be here to help and remind people that, especially for our youth, many times we take this for granted, the number one thing in our lives, and that is our health care. Many times, as young individuals, people are very busy, they're leading their hectic lives, they take their health care for granted. And that's something that you shouldn't do. Not just during the times when we have to bring our kids back to school, but on a daily basis. I can personally say that for the most part, I haven't taken care of my health. I just went to take a physical about 2-3 weeks ago. It was very important to me. And now as I'm getting older, I'm starting to think about my health care. Even though several years ago, I thought I was invincible. But now as I'm getting older, I realize that I'm not. So it's very important for the children to get vaccinated. It's very important for the community to know that we're going to have such a stellar center in Plaza del Sol. This is going to be so important for our community that's been hungry, that's been yearning for a place like this for many, many years. Councilman Montserrat and I have, ever since we've gotten into elected office, we've heard the complaints, we've heard the issues. My chief of staff, Janelle Atelier, and his chief of staff, Julissa Perez, that's standing next to me, have heard the complaints. And now this is a reality. Now in a month or so, we're going to open up this center. And like I said, it's going to be flooded. So